So let's talk about how to reduce high testosterone in females. Now, when you think of testosterone, you typically think of males because the male body is full of testosterone and the female body is usually not associated with it. Although the female body does have testosterone as well, just in smaller quantities. And it does play a very important role in human physiology for things like libido and maintenance of bone density, for muscle development, muscle mass, and several other things as well. So it is needed in the female body, but when it gets to very high levels, it can create problems. So you typically want to keep it well within the range of around 15 to 17 nanograms per deciliter. That's considered normal. Anything above that falls into the category of hyperandrogenism, which is just high androgens or high testosterone. So let's talk about what causes it and what the symptoms are, and then what can actually be done about it to solve the problem. So the most common causes are PCOS, that's polycystic ovary syndrome or polycystic ovarian syndrome. This is a condition in which the ovaries develop cysts. It's actually follicles that enlarge, and the ovaries actually will appear to be enlarged, and then these small little cysts or follicles will appear on the ovaries, and this can cause significant problems when it comes to hormone regulation, when it comes to the menstrual cycle. It typically results in menstrual irregularities, and it's the most common cause of high testosterone in females. It's also typically associated with high insulin levels and in some cases issues with the thyroid. Now, the next cause is congenital adrenal hyperplasia. This is a genetic disorder that affects the adrenal glands and results in overproduction of androgens. And so the symptoms simply vary from person to person, but it can sometimes cause early onset puberty, and it can have much more significant symptoms like ambiguous genitalia. But we're not going to get into that too much in this video. Next is androgen secreting tumors. These are tumors that can form on the ovaries or on the adrenal glands, and they tend to secrete androgens, but this is incredibly rare. And the last one is medications. Of course, if you've been on any kind of anabolic steroids or taken any sort of testosterone, then that can obviously increase testosterone levels. So let's talk about the symptoms. Well, the most common symptom that we see is hirsutism. This is basically the development of facial hair growth in females, and there can also be loss of hair on the scalp. Next is acne and oily skin, menstrual irregularities. Typically, you'll see a scanty period or a complete absence of a period as well in some cases. Then weight gain and obesity. Like I said earlier, sometimes insulin is also associated with conditions like PCOS. And it can result in obesity because insulin is it's an anabolic hormone. It's a fat storing hormone. Next is the deepening of the voice. Now remember, testosterone's function, one of the functions is for the development of secondary sex characteristics. And you'll typically see these male or masculinizing characteristics developing in the female body. And apart from facial hair, the deepening of the voice can also occur. There can also be muscle gain. And that again, testosterone is responsible for the building of muscles. That's why bodybuilders take testosterone sometimes to increase their muscle mass. Mood swings can occur, emotional changes, and if it's not treated and not managed, it can result in infertility as well as cardiovascular disease, and in some rare cases, even endometrial cancer. So let's talk about what can actually be done to solve this problem. Number one on this list is spearmint. Now, this is a very simple and easy remedy that's been clinically tested. In fact, there were two very promising clinical trials that were done on spearmint. And what was seen is spearmint twice a day was able to reduce free and total testosterone in women with PCOS. And it was also found to reduce the symptoms of hirsutism, so the facial hair growth and the hair loss on the scalp. Definitely something worth looking into. Now, I will say the spearmint tea, although it was used in a clinical trial and found to be effective, there are more efficient ways and stronger ways to use spearmint. You can supplement with an extract, but again, you should speak to a physician that specializes in using such things. That's going to be a naturopath, an Ayurvedic doctor, a functional medicine doctor as well. Next is myo-inositol. This is sometimes referred to as vitamin B8. It's actually a type of sugar that's produced in the body. And it's well studied for treating PCOS and improving hormone levels. And what was found in several clinical trials is that it was able to reduce testosterone as well as other things such as luteinizing hormone, PRL, insulin levels. That's another thing. Insulin, uh, myoinositol works very efficiently for reducing insulin and treating the condition known as hyperinsulinemia. And it was also found to restore the menstrual cycle in patients with amenorrhea. That's basically an absence of a menstrual cycle. And lastly, it was found to improve the symptoms of hirsutism as well. Now, keep in mind that by getting the insulin levels to come down, it'll also help to reduce weight. Next is zinc. Now, zinc improves some of the biomarkers and symptoms typically seen with elevated testosterone and PCOS. So that would be alopecia, which is hair loss, hirsutism, again, facial hair growth, and MDA levels. Next is selenium. It's another mineral that you can get from foods like Brazil nuts is the richest source. You can also get it in tuna and other seafood. It's very easy to get from your diet, but you can also supplement with it, depending on what's required for you as per your doctor's recommendation. It's also been found to improve biomarkers and symptoms typically seen with elevated testosterone and PCOS, specifically reproductive outcomes, HSCRP, that's high sensitivity CRP, that's an inflammatory marker, DHEA and MDA levels as well. So going back just to recap, spearmint, myoinositol, zinc, and selenium. That's my take on some of the remedies for reducing elevated testosterone in females. If you'd like to get in touch with me, you can do so through my website, drnishal.com. You can also just scan the QR code on the screen. I do online video call consultations, so no matter where you are in the world, you can get in touch with me and I can help you. I'll see you in the next video.